The dictionary defines dementia as a condition characterized by progressive or persistent loss of intellectual functioning, especially with impairment of memory and abstract thinking, and often with personality change, resulting from organic disease of the brain. Age is the strongest known risk factor, with most cases of dementia occurring in individuals over 65 years old. One of the biggest things I want to discuss in this video is how can we tell if someone has dementia? Would an MRI or a CT scan of the brain prove dementia? We often wonder if certain older people are plagued with this disease, so is there a way to know for sure? About 3% of adults ages 70 to 74 have been diagnosed with dementia, compared with 22% of adults ages 85 to 89 and 33% of adults ages 90 and older. There are actually 5 different types of dementia, so when you look at an older individual having memory issues, it could have many different causes. We'll start by discussing Alzheimer's disease and move on to vascular dementia, Lewy body dementia, frontotemporal dementia, and mixed dementia. The first and most common type of dementia we're going to discuss is Alzheimer's disease. Alzheimer's disease is the cause of dementia in about 60 to 80% of cases, and is the result of accumulation of abnormal proteins called tau and amyloid beta proteins in the brain. The buildup and accumulation of these abnormal proteins over time damages brain cells and leads to a decline in memory, thinking, and often changes in behavior. The trickiest part about diagnosing Alzheimer's disease is there is no single definitive test. You can't see this protein build up on MRI or CT scans. Doctors rely on information from the patient and their family members, as well as a test called a mental status exam to support this diagnosis. Alzheimer's doesn't have a blood test or anything where the diagnosis is so clear that you can definitely say a person does or doesn't have the disease. So in some cases, where a person with a career doesn't want Alzheimer's disease on their record, the patient might just avoid the doctor, or the healthcare provider may or may not be able to definitively diagnose that patient with the information from family that has been provided. The only way to diagnose Alzheimer's disease is post-mortem, after death, where the brain can be analyzed for tau and amyloid beta proteins. On average, people with Alzheimer's disease live between 3 and 11 years after diagnosis. Those diagnosed at an earlier age, in their 70s for example, often live on the longer end of that spectrum than those diagnosed in their 90s. Symptoms of Alzheimer's disease typically develop slowly over time, and they worsen progressively. Early symptoms may include forgetfulness, difficulty concentrating, and problems with language. As the disease progresses, people with Alzheimer's may become disoriented, confused, and withdrawn. They may also have difficulty performing everyday tasks, such as dressing or bathing. While there is no treatment for Alzheimer's yet, there are medications that aim to slow progression and improve symptoms. Lecanemab is a medication recently approved by the FDA as a treatment for early Alzheimer's. This medication targets amyloid plaques, the protein clumps associated with the disease. Early trials suggest it can slow cognitive decline by preventing these plaques from forming. It's administered via intravenous infusion. If you suspect you or a loved one has Alzheimer's, it's best to visit a healthcare professional to explore treatment options and lifestyle modifications to reduce symptoms. The next type of dementia we will discuss is vascular dementia. This is the second most common form of dementia, accounting for about 10 to 20% of cases. It is caused by damage to blood vessels in the brain, which can be caused by strokes, high blood pressure, or diabetes. Symptoms of vascular dementia can vary depending on the location and severity of the damage. They may include problems with thinking, reasoning, judgment, and planning. People with vascular dementia may also have difficulty walking, talking, or swallowing. The best way to prevent vascular dementia is by living a healthy lifestyle, not smoking or using drugs, and taking medications to treat medical problems like hypertension and diabetes. Treatment is aimed at preventing further progression of disease by treating the underlying causes like controlling high blood pressure, blood sugar control and diabetes, and reducing stroke risks. Next up, we have the type of dementia currently plaguing the former actor Bruce Willis and former broadcaster and media personality Wendy Williams.
It's called the cruelest disease you never heard of, but now that Bruce Willis has gone public with his diagnosis of frontotemporal dementia, or FTD, a lot more people know about it.
Frontotemporal dementia. Frontotemporal dementia affects the frontal and temporal lobes of the brain, which are responsible for personality, behavior, language, and movement. Symptoms of frontotemporal dementia can vary depending on the location of the damage. They may include changes in personality, behavior, and language. People with frontotemporal dementia may become withdrawn, disinhibited, or apathetic. They may also have difficulty speaking or understanding language. Frontotemporal dementia is known for affecting people at a younger age compared to other dementia types. Most people with this disease are diagnosed between the ages of 40 to 64. although it can occur in people younger and older. Medications used for Alzheimer's disease haven't shown much benefit in managing FTD. In some cases, they might even worsen symptoms. Doctors may prescribe antidepressants like SSRIs to manage anxiety, obsessive-compulsive behaviors, or apathy. Antipsychotics might be used in severe cases for uncontrollable behavior, but these are used with caution due to potential side effects. The primary goal of treatment becomes maximizing comfort, maintaining function for as long as possible, and providing emotional support to both the patient and the caregiver. The behavioral changes can often be the most severe in this type of dementia, stressing out both the patient and caregivers. On average, people with frontotemporal dementia live for about 6 to 8 years after diagnosis, though some may live more than 10 and those with rapid progression may only live less than 2 years after diagnosis. Next, we have Lewy body dementia. This type of dementia plagued actor Robin Williams.
This past Friday, a California coroner officially ruled Robin Williams' death a suicide, and now we're learning specifics about what may have led the Oscar-winning actor to hang himself in August. His widow, Susan Schneider, said Williams had Parkinson's disease, but a pathology report reveals he also suffered from Lewy body dementia,
although it was not found until after his death in 2014. This type of dementia is caused by the buildup of abnormal protein deposits called Lewy bodies in the brain. Lewy bodies can also cause symptoms of Parkinson's disease, such as tremors, rigidity, and slowness of movement. Symptoms of Lewy body dementia can vary depending on the location and severity of the Lewy bodies. They may include problems with thinking, memory, movement, and behavior. People with Lewy body dementia may also experience hallucinations, delusions, depression, and sleep disturbances. Lewy body dementia accounts for somewhere between 15 to 30% of diagnosed dementia cases. Lewy body dementia risk increases significantly as people age, with the highest incidence occurring in those above 65. The known risk factors include increasing age, a family history of Lewy body dementia, and having a diagnosis of Parkinson's disease. On average, people with Lewy body dementia live for 5 to 8 years following diagnosis, and younger individuals tend to have a faster decline compared to those diagnosed later in life. Mixed dementia is the last category of dementia on our list. Mixed dementia is simply a combination of 2 or more types of dementia, maybe Alzheimer's disease and vascular dementia, or Lewy body and vascular. Since the different types of dementia have different causes, it's possible for a person to have more than one type at the same time. Although dementia does not discriminate, there are things you can do to reduce your risk of developing dementia as you age. Living a healthy lifestyle, eating a healthy diet rich in antioxidants, and exercise have been shown to reduce dementia risk by as much as 60%.